In most cases, what you see on your medical bill is not what you have to pay. We did some research, talked to some experts, and we're going to tell you why and how to pay less on your medical bills. Welcome to Frugal Friends. My name is Jen.
My name is Jill.
And today we are talking about how to get as much as half off the medical bills you have received in the mail. This is a topic we get asked about all the time. And even though we've had medical bills before, we don't see a lot of medical bills. When I had my second son, I got an email with $70-ish thousand right in the body of the email. They didn't even tell me, go to your portal to get your bill. They just sent me the number via email. And it was shocking. And I am not the only one who has experienced this.
One hospital tried to charge me $32,000, essentially for a room rental, because that wasn't even including the surgeon costs or the anesthesia costs. And these are all the things that I wish that I would have known before facing some of those medical bills.
Yeah, so we have talked to several experts in the past, and they have all kind of laid out this kind of 4-step process to lowering your medical bills. So we're going to go through those 4 steps with you and cut to them when they have insight that really sheds some light on this experience. So when you get a medical bill in the mail or in your inbox, the first thing you're going to do is ask for an itemized bill and look for errors. And I asked Jared from $4, who you'll hear from later. I've heard the stat that 80% of medical bills have some kind of error on them. And I'm like, is that true? You've seen a lot of them. Have you heard of that? And would you agree? And he was like, yes, there's always some kind of medical billing error.
We talked with Scott Speranza, the CEO of HealthLock, who has audited over $500 million worth of medical claims about the most common medical billing errors he sees. And here's what he said.
Well, it's technically the only service I can think about where we don't know what we're going to pay before we get our service. Right? I mean, and this is, by the way, for medical, dental, vision, RX, right? So all those things are healthcare expenses. But of course, we might go to the drugstore and we think we're going to get a $15, copay for our RX. And all of a sudden they want to charge $750. What happened here? And now I'm stuck in line and I've got this big bill and it's stressful, and you just never know what's going to happen because it's a complex system. And again, especially when it relates to adjudicating against assurance. So adjudication is that word that says, an occurrence, a medical occurrence, medical, dental, vision, RX, a healthcare occurrence has happened. And I have insurance. And so someone's going to go bill my insurance company first and say, well, how much money is the insurance company going to pay me for the service? And everybody's got a different price. Everyone's got different negotiated rates. And then that claim gets adjudicated. And then I receive that wonderful thing called an explanation of benefits, an EOB. And that EOB basically says, this is not an invoice, but this is potentially what you owe. And then, of course, you've got the doctor, provider, lab, whatever it might be, actual invoice. A lot of times those don't match. And of course, what we're finding is that there are errors, unfortunately, that are made, whether they're simple, complex, whether they're nefarious or just, simple mistakes. All those things we see. And we've now saved well over $130 million for our customer base. And we have stories after stories of people maybe literally save them from bankruptcies, because 66% of all bankruptcies in the United States are due to medical bills. So it's not something that's actually getting better. It's actually getting worse. Your MRI might be the simplest, right? Some MRIs might be $500. Some are $1,000. Some are $2,500. Why? What's the reason for the price difference? If there was something specific that was that you received in the MRI that caused that, that's one thing. But for the most part, there's a lot of parity now with MRIs. So if we see a bill that comes in at 100%, 200%, 3% over our market price, that's going to get flagged. That's a common overcharge. You have things like duplicate service, where One doctor came in and said, "Hey, how you doing?" And then another doctor came in a while later and said, "Hey, how are you doing?" And there's two doctor codes on there for visits that could equate to, of course, a much larger bill. When did I check into the emergency room? That's a big deal, right? And so if I check in before a certain period of time, at my 24 hours, those change the rates. There's things called upcoding. I go into an urgent care and I need a Band-Aid for my cut, but they mark it as level 5, which means my neck is profusely bleeding. And these are the codes that they use. And of course, what you're seeing in the news today, this is a very common, unfortunate practice from the providers and even the carriers. What we've seen with Change Healthcare and the UHC debacle, data breach, is a lot of billing issues now are being exposed for fraudulent billing potentially. So the latest statistics is there's 171 million patient records breached last year. The year prior, there was about 60 million. The year prior to that, there was, I think, about 20 million. The year prior to that was just a few million. So the thieves have really moved over to healthcare and taken it by storm. And a fraudulent bill, which is also a balance bill. So one of the other keys is if you get a bill, your EOB says you owe $100 and you get a bill for $500, or you were never supposed to get a bill and you got a bill. Well, what is that? So balance bills, upcoding, denial of benefits, obviously something that is just completely out of whack as far as the pricing is concerned. These are the things that a consumer needs to have awareness around so they can protect themselves in their pocketbooks.
So when you are requesting an itemized bill, sometimes it's going to be easy, sometimes it's not. There are different types of itemized bills. So when you're doing something that's just for your own reference, then asking just for an itemized bill is probably going to be good enough. And even when you ask for one, they might go through it and you might end up getting a bill that's lower than the one you were initially sent because they're going to review that itemized bill before they send it to you. Also, ask for it via email. If you ask for it via mail, they might try to charge you, but if you ask for it via email, they're not going to charge you for that. There are different types. So you could be requesting a UB04, which is for a hospital. So if you're going to, requesting a doctor or a paramedic bill, they might not have the UB04. They might have something like a CMS 1500. So when they might get into the weeds asking you specific forms, and I know me using healthcare sharing, the forms do matter. But if you're not submitting it to a healthcare sharing, then an itemized bill should be good enough. The most important things is it has the CPT or the HCPCS codes, and these are procedure codes, the date of service, a description of each service or supply, a charge for each item or service, and a total cost. So these are the most important things you're looking for on your itemized bill. If they don't have those things, then it's not itemized.
The second thing that you can be doing is applying for financial assistance programs, even if you have health insurance. Most hospitals will provide income-based programs or charity care that you may be eligible for. And in most cases, you have 120 days from receipt of your bill in order to be able to apply for these financial assistance programs. And so we were able to talk with Jared Walker, the director of $4, which is a nonprofit dedicated to eliminating medical debt by making hospital financial assistance known, easy, and fair. And here's what he said about this topic.
I posted a video a couple years ago that it was just showing people how to find their own hospital's financial assistance policy, because the laws around these programs are very vague. It really just says that if you're a nonprofit hospital, you have to have a policy and it has to be widely publicized and widely available. So most hospitals hide the policy on their website, or they have a poster in the ER. So I think the best way to find out about it would be to just call the hospital and say, "Hey, I would like to apply for your financial assistance program," or Google your hospital name and the words financial assistance policy. Number one to keep in mind is they're not out here just telling every single person and making these programs really, really easy to access, unfortunately, but they do exist. I would say most people just assume that they are not eligible. I think when people hear the term financial assistance programs or charity care, they just automatically think like, oh, I didn't qualify for food stamps or I didn't qualify for Medicaid, so I'm not going to qualify for this. These programs are much more generous than other programs out there. And most people just assume that's not for me. So I would say most patients that come through are assuming that they are not eligible. And then they go through our screener and find out, okay, I'm eligible for a discount. Or, I mean, $4 has helped eliminate $90 million in medical debt. So we had one example would be there was a woman, her husband had passed away from COVID, and she got a $430,000 medical bill. And it was just like, not all the bills are that large, but it was just like, that is something that would bankrupt you. I mean, they would have lost everything and did not know about a program, did not think that they were eligible. We convinced them to see, we got the entire thing waived. So I'm in the Pacific Northwest. I'm in Portland, Oregon. Most hospitals around here will waive 100% of my medical bill or hospital bill if I am at or below 300% of the federal poverty guidelines. And then they will do a sliding scale up to 400%. So, what does that mean? It is if I'm a family of four, I can make a little over $90,000 a year gross annual income and be eligible for a complete waiver of the bill, and then a little more than that to receive a discount. I think the national average is about like 260% of the federal poverty guidelines, which again, as a family of four making, $85,000, $90,000 a year, you can still be eligible for a pretty significant discount, which I think is just more than what people think for what is eligible for these programs. But if you're in New York or if you are in San Francisco, a lot of this is based off cost of living. So there are hospitals in New York that go up to 800% of the federal poverty guidelines. You can be making, $150,000 a year and still be eligible because obviously it's more expensive to live there.
What I found really interesting was that different states, different areas, different hospitals have different requirements for how high, like above the federal poverty line, you can be. And so I loved finding dollar4.org to be able to have all that information in one place. Even if you are going to different like providers, you can get an idea of what you can be eligible for. And so the fact that, and I loved that he said, you could, if you fall maybe just outside those lines, you can always submit like a letter of hardship, some kind of letter kind of explaining your situation and get them to reconsider or just include you into that. He said that that has worked a lot. And I know for me, I don't feel like I deserve that. I think it should be reserved for other people less fortunate, or even like I feel like I put myself into this situation, so it is my responsibility to get myself out, not somebody else's. And so I don't want to ask for help. But I think the way that we are going to save the most on some of these bills is that every time we get one, we are following these steps to just find out, to just see if there's an error, to just see if there's some kind of financial assistance. And if the income is too high, send the letter, just see. And if you are not eligible or if you can't get it, then you won't. But you never know. And I think that is the thing that is most important, is that we put ourselves out there.
Not to mention, one of the things that we've realized when it comes to medical bills is that there are times when they are unplanned circumstances versus planned. So for instance, we might have preventative care or maybe elective surgeries that we can shop around for ahead of time versus unplanned crises that happen and medical bills just kind of fall upon us, and then we're kind of scrambling to figure out how can we lower these. And so we were able to talk with Jared about what he sees as the differences between these two and what we should be doing in order to lower that bill, decrease it the most that we can.
The first thing to know is that financial assistance and charity care can be done proactively. Um, think of think of financial assistance as a status that you have. So when you're approved for financial assistance, you will usually get a letter from the hospital that says, okay, you've been approved for, let's say, an 85% discount for 6 months. So any treatment that you receive within that 6 months is going to be covered under that 85% discount. Unfortunately, most people are not thinking ahead in that way, right? So people are applying for financial assistance usually after the fact. If you do know that you're planning a surgery or you're doing something that you're going to get a medical bill, you can shop around. That is like, again, there are websites where you can look at like what is the cost for an MRI here versus here, and you'd be shocked. Like those numbers can be drastically different. The other thing would be, if you have insurance, what is the cash pay rate? Like asking for, I know it sounds crazy because we all pay, like we're paying for insurance, but sometimes it is actually cheaper to not mention that you have insurance and just ask for the cash pay rate. So, like, what is this if I were to just come in and pay cash versus what is your deductible? Because sometimes it can be cheaper. So, I think there's a lot of things that can be done. Like if you have the time to do the research on, where can this be a cost savings in my area, and then after the fact, I mean, obviously, I'm going to advocate for applying for financial assistance and all that after the fact, and then obviously negotiating and kind of going down that road if the medical bill happens to you in an emergency setting.
The thing that stands out to me with that is the ability to shop around. I think we don't often think about that with medical bills. We kind of think we just go to the hospital, but it can be that one hospital in this part of town is charging 20 to 30% more than a hospital in another part of town. And so if we do have time on our side and the ability to make those phone calls, then it really could save us thousands of dollars.
I was shocked with how much you shopped around for your surgery you had last year.
I was tenacious
You
about
went
it.
so deep. You didn't just check the price for the doctor, but you went doctor, anesthesiologist, hospital, and it was that last one you checked is how you figured out that was $30,000 that you were not willing to pay. And it's so sad that you do have to do all that work. But if you get pre-approved for financial assistance, it can take some of that. It can eliminate having to do some of that, because if you're in a income bracket where you can get 100% like forgiven at a certain place, it can just take a huge weight off of your shoulders. So if you get your bill and maybe you do get some financial assistance or maybe you don't, then you have several options going forward. The first of those is to negotiate. And I was really impressed with Jared being like taking a hard stance, like 50% is like what I'm willing to pay. He told a story about like how he had like a $1,300 bill and he called and they negotiated down, but it wasn't what he was willing to pay. And so he asked to, speak to the supervisor, still, no more. So he just called back like every week for about 6 weeks, and then eventually did get the number that he wanted. And so that is, again, in my mind, I don't think it's going to happen for me, so I wouldn't put in that much work. But just knowing that somebody who does this for a living sees this, and he's not unique. He sees this for multiple people. He sees this every single day. It encourages me to try.
Yeah, Jared gave some great tips on negotiating medical debts. We want to share those with you.
It's a tall order. Like, you have to set aside time. You are going to wait on hold for probably hours. You are going to, but you call the hospital, you ask, what is the settlement amount? Like, those are the magic words when you're negotiating. And you have to come with money in hand, right? Like, you have to have an amount that you are offering. We can get into negotiations, but I would say, yeah, if you are not eligible for financial assistance, the next best thing is, what can you negotiate? What people need to realize is these the provider, the collection agency, like they want to close this out just as much as you do. Like they are trying to collect and move on. So if you can give them, if you can offer an amount that is acceptable, like they will take it. Absolutely.
So in January of 2025, a rule passed that creditors cannot put medical debt on your credit report. And Jared told us you have 1 year from when you get that first bill to make some kind of payment. And as long as you make something, they have a full other year to make anything before it goes on your credit report. But in a strong negotiation, when you talk to them, you want to be able to pay in full. But that just means you have a full year from receiving your first bill to having to pay, even if it goes into collections, before you see anything on your credit report. And so I thought it was very eye-opening, because this is something I have done in the past because I haven't necessarily been worried about my credit score. My credit score was so high. I'm not taking out any extra debt. So it's something I have used, but now it's something more people can use. And I asked Jared, do you see a difference in negotiating between a hospital, a doctor, a clinic, or a collections agency? And here's what he had to say.
Yeah, I think it is. I mean, I think the larger the system, the more willing usually. Like when if I were to call my local chiropractor and try to like negotiate, it probably wouldn't go over as well as like a large lab, company or a hospital. Ambulance, I feel like, are pretty darn willing. There are certain ambulance companies that have something called a compassionate care program. It is financial assistance, but they will not extend it to you unless you ask for it by name. Compassionate care program. I think that the ones that are harder are, those smaller clinics and stuff like that, that aren't a part of a larger system, especially a nonprofit. Like nonprofit hospitals are more willing to negotiate, I would say.
So I hope that encourages you to use all the strengths you have, use everything that's in your corner to get the best negotiation outcome on your own, knowing some of this stuff now. But then there also just comes a point where you don't want to negotiate, or you don't have time or the capacity. And then that's where step 4 comes in, where there are services that will negotiate for you on your behalf if you're not eligible for financial assistance. Jared's nonprofit, $4, will help people who are eligible for financial assistance to get that, and they will advocate for you. But if you're not, there are medical advocates out there like goodbill.com or individual medical advocates, and that's a paid service. So you will usually pay a portion of your savings. But if negotiating just isn't something you can do, maybe you have too many bills, then that is an option.
And the goal with something like this, when it can be worth it to go with a medical bill advocate, is when they can decrease your bills by about 50%. And usually that might be something that you could talk to the person about ahead of time, of what do they think they might be able to do for you in this situation before you are signing any type of agreement for kind of what you're going to end up owing them through the process.
So those are the 4 steps in your journey to getting a medical bill or even medical debt negotiated down. Getting that itemized receipt, checking your eligibility for financial assistance within 240 days, negotiating, and that's where we really get into, even when you get into collections, when you have medical debt, it becomes much easier to negotiate, and using that 50% number is kind of like a rule or a guide. And then if you can't do it on your own, using some kind of medical advocate. We hope that this encourages you when you get your next medical bill, or if you are struggling with medical debt, that you will take these steps to get your medical bills lowered. And I hope, we do want to leave you with this kind of story from Jared about how in just an hour and a half, what their team was able to get assistance and essentially, forgiveness for how many medical bills they were able to get.
Every day at $4, we have a Slack channel that is the community celebration channel. So every single time we get a medical bill eliminated for a patient, it goes into this, and we all, celebrate. As of yesterday, I'm just going to read you bills that we have eliminated today since 9 a.m. So this is an hour and a half. Okay, we have a $7,800 medical bill eliminated, 6,018, 11,000, 3,000, 744, 360, 4,900, 24,000, 1,200, 4,200, and 6,700. So those are the bills that we've eliminated so far today. But what is fun is when patients tell us a little bit about their story. So we had a patient say, I got this medical bill and I was forced with the decision, and this happens all the time, am I going to pay this medical bill or am I going to continue my education? She was young, going through school. So she sent us a photo of her on her graduation day and said, because $4, I was able to continue my education and graduated.